My labor started at 3 a.m. I snuggled under the covers and didn't time the contractions. By the time the sun was starting to rise, they were more intense and Cassie started timing them. At 7 a.m., they were 3 minutes apart and we called our midwife.
My second labor started right in the middle of dinner time. When we finished, Luke took Jacob, my toddler, and got him to bed while I got everything ready for the midwives. By the time Jacob was asleep, the contractions were pretty hard and fast.
We were planning a hospital birth, but the midwife said we could labor at home until it was closer to the time to have the baby. The midwife checked me, said I was in good labor, and stayed with us. We were so excited.
When the midwife got to our house, she checked me and I was already 6 centimeters dilated. So she started setting up for the birth. I called my mother and she came over to help out in case Jacob woke up.
When I was about 7 centimeters dilated, we drove to the hospital. We got settled in there and labored some more. And then our baby was born just before midnight. I reached down and lifted her to my chest, and we were both just kissing her all over.
Pretty quickly, I felt like pushing. This was my second baby, so the pushing went so much faster. Luke held me the whole time.
My name is Shazeen Suleiman, and I am a registered midwife. After a birth, we always watch closely to make sure our clients feel well. Losing some blood after having a baby is completely normal, of course, but sometimes there is more bleeding than we would like to see. Most midwives and doctors will say that postpartum hemorrhage is losing 500 milliliters or about 2 cups of blood after a vaginal birth, or more than 1,000 milliliters, about 4 cups of blood after a cesarean section. Regardless of the amounts though, we start to take action if the bleeding is uncontrolled or the person starts to feel unwell. We're equipped to manage hemorrhages that may occur after a birth. We can administer several different drugs to treat the bleeding, and we carry these medications with us to home births. If the bleeding is caused by a tear in the skin or muscle around or inside the vagina, we can stitch the wound to stop the bleeding. Sometimes we manage postpartum hemorrhage at home, and other times we transfer with the client to the hospital. Midwives are well integrated into the healthcare system and emergency transport services. This means that doctors are available to help when the bleeding is severe and their medical or surgical skills are needed.
The midwives were really good at explaining what was happening, but I still wasn't prepared for how many people were in the room. I got 2 more shots and they put in a catheter, and that was painful. I got an IV and got pain relief, and we went into the operating room. I wish they could have left my baby on my chest. It was hard to be separated from her, even though I knew she was skin to skin with Cassie. That was a rough start to the bonding process for sure.
I didn't end up having to transfer to hospital. The midwives managed the hemorrhage. I didn't really know what was going on at the time. I was like, la la, so happy with my baby. And then suddenly I didn't feel so well. I just remember the pushing on my stomach. It was painful because I didn't have any pain medication at all. I was just so grateful that they kept my baby on me and nursing while they were dealing with the hemorrhage. Afterwards, my midwife said that if the drugs hadn't worked right away to stop the bleeding, we would have gone into the hospital. I don't know why I bled so much this time. My last birth was fine.
When you lose too much blood after a hemorrhage, your iron levels can drop, making it difficult for your blood to carry enough oxygen. Not having enough iron in the blood is called anemia. Anemia can leave you feeling weak and tired, dizzy, out of breath, and grumpy. It's important to get your iron levels back to normal so you can start to feel better again.
I'm so exhausted. I just walk to the dining room table and then have to go back to bed. When I tried to wash my hair, I couldn't even lift my arms. My next door neighbor had her baby around the same time as I did. I looked out the window yesterday and saw her running with her stroller. I haven't been able to get out of bed. I've been having flashbacks to the pain, mostly the pushing on my stomach. I can still feel that. I feel like the hard physical recovery is all kind of wrapped together with the emotional stuff. It's hard to know what's normal. I guess I just feel a little bit alone.
The recovery from a PPH can take a while. You're recovering from a birth and a hemorrhage. That's a lot to handle. Being gentle with yourself is really important. The symptoms of postpartum depression and anemia can look very similar. Sometimes you can be tired because you're anemic and also be depressed. Midwives have screening tools that help identify postpartum depression. Talk to your midwife if you have concerns.
We're coping. I'm exhausted. But my mom has been a huge help, and Luke has been doing all the housework. Also, I've never been so hungry in my life. I only realized after how terrified Luke was. You don't really realize until after what an emergency it was. The midwives were so calm. We just followed their lead. The only thing I'm worried about is that I don't seem to have as much milk as last time.
Some people find their milk will come in a little bit later when they've lost more blood than normal, but there are herbs and medications that are safe to take that can help with milk production. If you have any concerns about how much milk you have, just talk to your midwife. Remember, as long as your baby has enough wet diapers and is gaining weight normally, you're making enough milk. If you've had one birth with a PPH, your chances of having one again are higher than someone who's never had a hemorrhage. Next time you're pregnant, make sure to tell your care provider that you've had a PPH with your last birth. It will be important to make sure your iron levels are healthy. This will lower your risk of becoming anemic if you have another hemorrhage. It can also be important for you and your family to go over your birth and the experience of the PPH, and to ask your midwife any questions you have. Some people who experienced a PPH find that they have questions days or even months after the birth of their baby. Ask your midwife if there's any way to get in touch if you have questions about your PPH after you are discharged from midwifery care.